Assalamualaikum and hi to our lecturers as one. We from group ADS514 group 3 want to present our topic, which is the implementation of policy for national mental health policy. So our group consisting of 4 students, which is including me, Farish, Danial, Joenyez, Noel, Nixon Henry and Ibadurrahman. Okay, first I want to present about my part, which is the introduction of this policy. So a healthy life, either mentally nor physically, could lead to a more productive life. As of Malaysia, it is a country that prioritizes the health of the people, especially in their mental health. So every day we are exposed with a problem that could bring effect to our mental health, such as pressure from work, traffic jam, and also from people around us. So mental health is a really important thing for us to control it because it could bring harm to our life mentally and internally. So according to Janvi Kapoor 2022, mental health have a significantly importance for our body as the same as physical health is to our body. So mental health contains our emotion, psychology and social activity. So the introduction of the Mental Health Act 2001 was to streamline the way that both the public and private sector provide mental care service. Okay, so that's all from me. I'll pass this to the next presenter.
Okay, greeting to Sazwan. My name is Joenyez Noel. I will be talking about the issues on national mental health policies. Okay, firstly, one of the issues is a lack of core indicators leads to invisibility and marginalization of people affected by mental disorder. This is one of the issues in the implementing of mental health policies. One contributory factor to the low priority given to mental health is the lack of visible core indicators. The lack of international investment in mental health infrastructure, information system and research hampers the ability of Ministry of Health to make an effective case to ministries in finance. These indicators could go beyond clinical measures of health and mental health, but look at the other key economic and development indicators such as socio-economic status and participant in everyday activities such as employment and education. The second point is mental illness is not perceived as amenable to quick solutions is also an issue where most of the mental health caretaker did not perform well in providing them help. These challenges is where the policymakers do not perceive mental health as being amenable to define, easily costed, readily understood, and easily implemented solutions. The economic case for investment in mental health needs to be clearly made. Example, medications are one of the key components in addressing severe mental disorder, and indeed the psychotropic medicines on the essential medicine list of low-income countries are inexpensive, affordable, and effective. Other issues in performing national mental health policy is human resource planning. This challenge is compounded by the fact that numbers of both primary care and specialist mental health staff in many low-income countries is dwindling rather than increasing. Reasons for this include increased training costs, immigration from rural areas to urban areas, flight from the public sector to the higher paying NGO and private sector institution, movement into other health sectors, and migration from low income to higher income countries. Integration of mental health into the social development sector is one of the issues in national mental health policy. Research on the etiology, epidemiology, and impact of mental disorders has demonstrated the multi-axial nature of causation caution and consequences, and effective interventions from mental disorders. But the perception that the practice of psychiatry is still based on the predominantly biomedical model alienates social development experts who would otherwise be natural partners for those wishing to improve the mental health population. The fifth challenges issues is avoiding a narrow focus on psychosocial issues. Such standard and guidelines that have been developed often have not included any collaboration with other key sectors such as education and social protection, despite evidence that it is possible to develop and successfully implement integrated mental health and psychosocial programs. But not least is access to mental health intervention. Mental disorders generally respond to a comprehensive intervention of psychological, social, and medication component. In high-income countries, there has been major investment in novel medicines which have less side effects and similar outcomes to off-patent medication. In low-income countries, there are issues with medication procurement and distribution which hamper ready availability of psychotropic medications at district and primary care levels, aggravated by lack of resources, poor evidence planning, and stigma about the need of mental health intervention by those involved in the distribution.
Hello everyone, my name is Ibadurrahman and I'm going to present about the implementation of mental health policy. I mean the objective. The introduction of the Mental Health Act 2001 was to streamline the way that both the public and private sector provide mental health care. Its vision was to create a more healthy and balanced society in terms of their mentality, psychology, and to make them aware of their mental health. This policy is also vision to provide a treatment center to those who have a mental health problems, and this place also will teach them how to overcome it and will explain to them the method of doing it. This policy or act is a really good creation because it can help make it aware that mental health is also important as physical health, and this open up the people's eyes about the well-being of their mental health. This policy also have a lot of objective, and it is to provide a strong structure of ideas and guides for the other sectors to implement or provide mental health care in their organization. This way is to make sure that it can maintain the level of mental health of all the citizens of the country. Next is to improve the mental health service in order to help the patients of mental health problem. Other than that, it is also to help provide health care for the people that in need help for their mental health, and to make sure their welfare and their well-being is protected and more secure so that their mental health will not go too far that will bring harm for their life. I think that's all from me. I'm pass this to the next presenter. Thank you.
Hello to our lecturer and all my fellow classmates. My name is Nixon Henry, and today I will present about the challenge and recommendation for the national mental health policy. So for the challenge is the need for more awareness in our society. As we all know, not all people know enough about the national mental health policy because of the unclear information about its implementation. The lack of knowledge and awareness of this policy importance come from the public that ignore this policy. And the next one is lack of participation of the public because of our society attitude, where almost 62.3% of society does not want to tell the problem that has been suffering by them. Thus, the goal of this program is hard to achieve because it needs support from society to make this program successfully implemented. The organizer and government have organized due to a lack promotion. Based on the activity that have been done, the activities could have reached the target correctly. The accessibility that the organizer or government has applied is to ensure that the public has access to the product and services that have been made, like specific information about the program. So for the recommendation is, the national mental health policy needs to improve its promotion to get much of society to join the program. The program organizer must be creative when trying to promote the event. As we all know, there are a lot of advanced technologies have been created in social media. It will increase participation if the organizer promote through media platforms like TikTok, Instagram, Facebook, and so on. The information about the program must ensure that it can be quickly accessed because the most effective way to promote it is through social media. Also, they can pay a significant influencer to promote the program to attract people to join it. Besides that, the government must also inform the public about what service will be offered. The government can also use social media to get public feedback on the best way for them to join the program quickly. Also, the government can make a good decision on how the program will be conducted in the suitable place to do the program. The result of the program will be overcome if the government is aware of the problem from the past event. The process of the decision making can be considered based on decision making that has been done through the feedback that has been given. That's all from me. Thank you.
Okay, in a nutshell, the governments play a big role in implementing this policy to the people of their country. So there are a lot of policies on the country that have a significant effect to the welfare of the people, especially in terms of mental health. It is because mental health is not a thing that can be seen by our eyes, because it can only be diagnosed if the person tell us of their mental state. This is why this policy can become the problem solver for the people who suffer from a mental health problem. Okay, so the government should be more aware of their people's welfare and well-being by implementing more policy that will bring benefits to the citizen, especially when it's related to their health. So this way can help prevent the people on the country from getting harmed by any health problem, either mentally nor physically. So that's all from us. Thank you for watching.